It's time for the Dr. Cho Show, the show that helps you understand the latest and safest modern dental techniques for you and your family. You'll become an educated dental consumer and also learn about health trends outside of the dental industry. Here's your host, Dr. Dan Cho.
Hello everybody, welcome back to the Dr. Cho Show, your number one resource for everything related to your oral health. My name is Dr. Dan, and today I wanted to talk about something that is a kind of a little bit of personally relevant for me, and that is protecting your teeth during contact sports. And if you stick with me to the end, I'll tell you how to get a free custom guard. So, as the world is kind of going back to normal and, sports start to kind of reopen and all those things, I can definitely see this topic becoming a little bit more and more relevant as, especially, children's sports in high schools, they all start to kind of go back into kind of, hey, back in the swing of things. And so this is kind of a little bit of a personal point contention for me because so I guess I should start off with a little bit of history for myself. So I used to, and I plan to back in a little bit of time here, to go back to actually doing jiu-jitsu. So Brazilian jiu-jitsu is something, a martial arts. It's a grappling sport that I had practiced for a little over 6 years, and I stopped just before COVID. I should say I stopped because of COVID again, and during my time I have seen quite a few injuries. One in particular that kind of really stuck to me because during the entire time that I was training, I was a dentist, and there was one particular injury where somebody took a rogue elbow to the face and ended up kind of fracturing some teeth, and the tooth fractured in a way where actually the nerve was visible, and of course it was uncomfortable, and yes, I did help the person, but it was something that was very, very, very easily prevented. And afterwards, I finally convinced the person to actually go and get some mouth protection, and he now spars with that, and so it's one of those injuries that's kind of every time that I see somebody doing a particular jiu-jitsu in particular, but any kind of really heavy contact sport without the proper mouth protection and things like that, it's just something that is I feel is something that's very, very, very preventable and can easily save somebody from a long road of kind of headache. And so that's kind of the main thing over here, that I'm not saying that somebody shouldn't go and play basketball or play football or participate or in any type of martial arts, or I mean, geez, even soccer or some of those things, but it's being able to do those things well and safely, which is going to overall benefit either your health, your children's health, maybe both, So when it comes to high impact sports or martial arts, really anything, the main thing that's going to happen is some sort of direct trauma to the teeth themselves, whether or not that be in the instance that I saw was a rogue elbow, but perhaps it could be, somebody kind of headbutting or falling down and getting a hit, or during a tackle or something like that. And so the main way to do that is kind of like anything, in football. You wear a helmet to protect, to absorb that heavy tackles. Same thing for your teeth is that, you wear a sports guard, which is essentially either a custom or semi-custom fitted hunk of plastic, rubber, I should say, that actually absorbs a lot of the impact and helps to protect the teeth, because that energy transfer is going to have to be getting absorbed through something, and we'd rather it be getting absorbed through the actual rubber itself rather than the teeth and the jawbone. So they essentially reduce the chance of fracture to the teeth and the jawbones, and they do actually a really, really, really good job of even protecting the teeth from each other during clenching. If you've ever been and done any kind of high contact sports, or if you're even trying to lift a really heavy object, a lot of people, what they'll do is actually they'll clench their jaws to try to generate more force, and that kind of force from the tooth contact, especially with a lot of forces being generated, can end up putting additional strain and pressure on the teeth themselves, which in the long term will increase the chances of some sort of fracture. So, like I had mentioned before, most of the time, type of injury is going to be traumatic in nature. There's almost never any type of disease. Well, I should say a disease could be an underlying contributing factor to fracture. And for instance, there's a weak tooth that has a big old cavity inside of it, and you're playing soccer, and during soccer you're going for a slide or trying to get the ball, you slide down, you fall, you take a tumble, and that weak tooth with the cavity, that's really big cavity that's underneath there, can actually make the tooth fracture as well. So but it's not really going to be something, most of the times it's going to be something that's traumatic in nature. And so when there is something obviously traumatic, we're talking about fracture. So that could be a fracture of part of the tooth. It could be a fracture where it doesn't involve the nerve. It's just a little bit off the very edge of a tooth, just the enamel. It could fracture into the dentin and then cause a lot of sensitivity. It could also fracture, like in the instance where I was a witness to, it could fracture and actually involve the nerve. The worst case scenario is it could fracture and have the tooth actually either a volts completely come out or fracture underneath the bone. In which case, the treatment is going to kind of really vary depending on what happens, and whether or not quickly and correctly as well. And so depending on what happens, I mean, there are multiple ways to be able to fix it. I mean, even if there are ways to be able to fix it. For instance, there was a particular time where I had a patient who went to a hockey game, and he was sitting in the bleachers, and wasn't quite paying attention to where the puck was going, and unfortunately the puck came out and actually hit him in the face, and ended up breaking I believe it was 4 or 5 of his teeth, fracturing his jaw. Some really, really, really nasty stuff. And even through all that trauma, we're still able to fix. We still can give him back his teeth and all that, but it's still a very, very long and arduous journey that he has to go through. And so not that I advocate wearing a sports gauze when you're observing a high impact sport, but obviously if you're participating in one, then you'll want to wear it. So the most common sports, because there are some, I will admit, for instance, like tennis may not be something that is really going to necessarily require a sports car, but there are definitely some sports that kind of, it may be a good idea or it might not be. So the obvious sports are really most martial arts that contain any type of sparring. So that's karate, taekwondo, jiu-jitsu, judo, wrestling, those sorts of things. Those are definitely ones that you'll want to. Other really popular contact sports, hockey, basketball, football, obviously. Probably not baseball. However, sometimes there can be some kind of contact, and so baseball and, for instance, soccer are going to kind of fall into those. I mean, they're semi-contact, but do you need to have them? I would say that if you have any kind of real doubt about it, then getting one is never going to hurt, and so it could be something that as simple as wearing this mouthguard can really kind of save a lot of headache down the road. And so I've heard a lot of concerns about it as well. The primary one being, well, I can't breathe, I can't wear it, I can't get used to it. Is it really, helping? And, a lot of the studies do show that that there's kind of a balance. It's going to be about a 4 to 6 kind of millimeter guard that's going to kind of show to have the most effective impact on kind of having shock absorption, and also not having something that's so thick that it is unbreathable. Because I do agree, if you are, obviously if you're playing football, or doing basketball, or doing any type of martial arts, that you'll need to breathe. You're exhausted. You're exerting a lot of energy. You need to be able to breathe to be able to actually perform the sport well. And I can personally attest to say that yes, I mean, with the fully custom ones that are made typically in a dental office, those ones are actually fairly easy to breathe in. I've worn one for my entire time while practicing jiu-jitsu, and they are actually pretty easy to be able to breathe in. They don't really restrict the ability to breathe, and they also can offer a lot of protection. Now, I have also tried several other types of sports guards, some of them that are exceedingly thick, and those ones are definitely much more difficult to be able to breathe into, and so it'll kind of really depend on which type that you have. You want to get something that's a little bit thicker than something like a night guard. Those can actually be pretty thin, or something that will give you a little bit more protection, but you don't want something that's so thick that it's going to actually not allow you to breathe. And so those are just a couple of things to overall kind of keep in mind. And so there are definitely a bunch of different types of guards. There's the boil and bite. There are kind of the semi-custom ones, like you can get like a line, and there are also kind of the fully custom ones. And my obvious kind of preference, I will admit I'm biased, but my obvious preference is going to be, definitely going to be for the custom guards, because they're exactly that. They're custom. Teeth are one of the final kind of things that almost everything has to be done custom made. A crown that fits for you or a denture that fits for you is not going to fit the next person, or even a family member. Everything has to be exactly custom fitted. And while there are some kind of ones that kind of can get the job done, by and far, for almost everybody, I know that a custom fitted guard is definitely going to work. And so getting a guard, the overall process is fairly easy. It's built or made off of if you're to use the boil and bite, the best way to do it is to follow the instructions. You boil the material, you bite and hold it, and it kind of semi-forms to the mouth. The other ways are to have some sort of a mold made of the mouth, and then based off of that mold is the actual guard itself is made. And so that I mean is pretty much it in a nutshell. I know that it could essentially be boiled down to if you play a contact sport, wear a guard, but I believe that it is important that everybody understands, hey, this is kind of what it does. This is kind of the main goals that we're having from it. And as sports become hopefully again a little bit more prevalent once kind of COVID hopefully starts to kind of really taper off again, that I think is important that you at least consider wearing a guard, or if your child has plays any sports, it's to consider getting a guard for them as well, because it can, trust me, I've seen it, I've been on the treating, it can definitely save a lot of headaches. So like I mentioned before at the beginning, if you wanted to figure out a way to get a custom guard, and that's just to give us a call, come in for an exam, let me take a look at your teeth and make sure everything's healthy, and that will make you a guard for free. So the way that you can get a hold of us is to give my office a call. The number is 503-646-4600. You can also email us at info at lifebloomdental, LIFEBLOOM dental.com, or you can go to our website, which is Portland's Dentist, PORTLANDS dentist.com, and mention the podcast, and if you come in, I'd love to meet you, see if there's anything we can do for you. So if you have any questions, you know how to get a hold of me. Otherwise, stay safe out there.
Thank you for listening to the Dr. Cho Show. If you have any questions for Dr. Cho, you can reach him at www.portlandsdentist.com or by calling his office at 503-646-4600, or feel free to send him an email at info@lifebloomdental.com.